Hey, Cynthia, POP was such an amazing conference. Um, like you said earlier, every time we go, it's always reinvigorating, rejuvenating. It kind of gives me a fresh start all over again. And the best part for me is always running into old friends and colleagues who are in different parts of the state.
It really is. Sometimes I feel like when I go to pop, it's just like we're having a huge party for several days, and it's so much fun.
Yeah, and lucky for us, we got to sit down and talk to one of the goats of family medicine, the one and only Dr. Shannon Connolly, who also won the Family Physician of the Year award. That was quite an amazing conversation.
Yeah, she is such an inspiration, and her work in reproductive health advocacy is something I've always wanted to chat more about. And I was just so excited we all found the time to be able to do that. And now we get to share that with all of you.
Yeah, so buckle in and listen up for our wonderful conversation with Dr. Shannon Connolly.
All right, welcome to the Family Docs Podcast, brought to you by the California Academy of Family Physicians. And I'm your host and favorite family physician, Dr. Rob Assibey.
And I'm your other favorite family physician, Dr. Cynthia Chen-Joea.
And we're here today doing a special on-site podcast interview at POP with the one and only Dr. Shannon Connolly, diving deep into a critical conversation on women's health. Dr. Connolly is the Associate Medical Director of Planned Parenthood of Orange and San Bernardino County and is incredibly passionate about reproductive health and access. She's been on the front lines of ensuring patients and physicians have tools and training they need in this challenging political climate. And just today, she won the 2025 Family Physician of the Year award. So, Dr. Connolly, welcome to our podcast. And congratulations again today on your wonderful award. Couldn't be any more well-deserved. Now, could you please give our listeners a brief introduction about yourself?
Thank you so much, Rob. Thanks for your really kind words. I'm really happy to be here with you, Rob and Cynthia. My name is Shannon Connolly. I'm a family physician first, and I do a lot of work in the space of sexual and reproductive health care. In my daily work as a clinician, I do general primary care, I do gender affirming care, behavioral health care, and some abortion care. And then the other half of my life, I'm an administrator. So I oversee our primary care and behavioral health programs. And then I love doing things with the CAFP for fun. So I try to spend as much time with my CAFP peeps outside of work as I can.
Yes, and a huge congratulations from me too. I couldn't imagine anyone more well-deserving. And I'm just so curious, what inspired you to dedicate so much of your career to reproductive health advocacy? And was there like a defining moment or time or patient story that helped you make that decision and commitment?
Yeah, well, I grew up in Virginia, in a fairly rural area of Virginia, that one might call the Deep South. And so I didn't really think a lot about reproductive justice issues as I was growing up. And then when I was in college, I did some work with a peer counseling program that specifically looked at issues of women. And that really kind of got me started thinking about reproductive justice. And so after I graduated from college, I worked at a Planned Parenthood in Boston. And in that role, it really, for the first time, I understood that access to comprehensive reproductive health care was limited for so many of my patients. So that really made a big impact on me. At that point, I didn't know I wanted to be a doctor, but one of the doctors I was working for really encouraged me to go to medical school. And I think that was the thing that set me on the path that led me to be here today. And then when I was in medical school, I had a mentor. He was now a very famous physician named George Tiller, who is perhaps well known, unfortunately, because he was murdered. He was an abortion provider in Kansas, and he was an incredible advocate for his patients and just an incredible role model for all physicians. He was so patient-centered. And one day, somebody walked into his church where he was working as an usher and shot him. And it was because he was an abortion provider. And so that was my second year of med school, and it really had a tremendous impact on me. And it really felt like in that moment, the most important thing I could do with my life was commit to being an abortion provider. And so that was kind of why I ended up, becoming a doctor. And it's something that I wanted to make sure I did in my career. And along the way, I fell in love with family medicine as a great way to do whole person care for my patients. And it's all kind of fit together. So it was really that formative experience of having somebody that I admired so much be murdered for doing the very thing that I admired that he did. That really put me on this path.
Wow, that's a very heartwarming story, and I can easily see like how that something like that can kind of put you into this path. That is very hard, and it's kind of shows a lot about the world we live in still now. Like, we talk about this was however many years ago, but from your perspective, there are still a lot of challenges that we see right now. So in regards to women's health right now, what are the biggest challenges that you think family physicians that we see in our clinics and everything going on in this climate?
Right now in this moment, I think we're facing more attacks on sexual and reproductive health care than we have at any other point in my career. Ever since the fall of Dobbs, that was the Supreme Court decision that overturned Roe versus Wade, and then some of the subsequent things that have happened state by state in our country, we've seen that access to abortion care, first and foremost, but other types of reproductive health care have been restricted in ways that have had devastating impacts in our communities. And so as family physicians who are always on the front lines, I think we are starting to really see the impact of decreasing access to life-saving care and what that means for the patients that we serve.
This topic is just really close to home for me because I have a daughter. So when I think about how this could potentially impact the life of my daughter, it's really concerning. My question to you is, in light of today's federal political climate, what are you seeing in terms of access to birth control and abortion care?
Yeah. Well, I do feel incredibly fortunate that I live and practice here in California, and California has pretty progressive laws and protections for these types of services. But even still, I've seen a really tremendous change in my patients' ability to access care. And I'm also seeing more and more patients that come from outside of my community seeking care because they can no longer get the healthcare that they need where they live. And so, a big example of this is after the Dobbs decision, I started seeing patients for abortion care who were coming from out of state. And it wasn't uncommon to see somebody who'd driven 200 or 800 or 1,000 miles to get access to, for example, a medication abortion. And that's something that's become almost an everyday occurrence now. I see people who come from really far away. But even within California, there hasn't always been, and I hope one day there will be, but there's tremendous barriers for our patients even in California. And one thing that I've noticed is that patients are still within California driving hundreds of miles to access the care that they need. There's also a lot of confusion about what type of care is legal and accessible. And so our patients come in and they're like, can I even have an abortion? Is my birth control covered? What if I want an IUD? I've had patients who are going to leave the state, and before they left California, they wanted to either have some sort of long-acting contraception, or they wanted to do a sterilization procedure before they left because they knew they were going to a state where these types of services were not accessible. And then I also just want to say that while I think about and talk about abortion a lot of the abortion providers in communities across the country were also the primary providers of general obstetrical care, of other sexual and reproductive health services, cancer screening services, of gender affirming care. And so as those clinics and facilities were shut down and those providers were leaving those communities now are, obstetrical deserts oftentimes.
Yeah, that is extremely concerning for especially all of our family physicians and all of our patients, because obviously we went into medicine to take care of patients. And to Cynthia's point, like, it's become personal because you have a daughter and we all have sisters, moms, and all of them are at risk based on these policies, right? So how can we, or what role do you see the listeners and us as family physicians to play in ensuring that all of our patients continue to have this safe, equitable access to reproductive services, where they may not have to drive hundreds and hundreds of miles to get this care?
Well, the first thing that I would say is if you are in training right now, or if you are a doctor who trains residents and med students, it's so, so important that we provide comprehensive sexual and reproductive health training to our trainees so that when they, graduate and become attendings and hopefully go into communities where they are needed, they will be able to provide those services. I can't tell you how often I will see, residents who will say, I really, really wanted to get this training, but it wasn't offered at my program, or, I had to use all of my elective time and go someplace really far away to get this training because it wasn't available for me locally. And we really need to say that that's unacceptable. And if we are to train comprehensivists, which are what family doctors are, we really need to ensure that we give them all of the skills that they need to be able to adequately serve their communities. And we know that family doctors are, the major medical providers in rural America, in places that have access issues. And so we need to make sure that they know how to do those things. So, to all the residency directors out there, please make sure that your medical residents are learning how to manage all forms of contraception, make sure they're placing those LARCs and really feeling comfortable with those LARC placements by the time they graduate. Help them get comfortable instrumenting the uterus, teach them how to do uterine aspiration, teach them how to do medication abortion, because these are all things that are well within the realm of family physicians. And if we can train enough people, at least in states where that training is legal, hopefully we can continue to meet the need in our communities.
And I think you mentioned a little bit before about some of these federal court decisions that have happened, and now how politicized the subject is. And you just talked about challenges that our learners, medical students and residents, are facing around getting training, even a little bit, even adequate training around this. What implications might that offer because of these challenges and barriers to training?
I'm really disheartened right now because when I look at a map of the United States and I look at how many states there are now where abortion is either completely illegal or so heavily restricted that it's functionally not accessible, I also think about the trainees in those states and whether or not they are able to access that training, and they're not. I mean, obviously, if you train in a state where abortion is illegal, you're not going to have any access to the training that you might need if you wanted to be an abortion provider. And so right now, since the Dobbs decision, we have an entire generation of medical residents that isn't being exposed to this type of care. And they are going to grow up and become attending physicians and go into communities and not have that skill set. And it's not, I don't have an easy solution for how we're going to bridge that gap. But I do think as a community, as family physicians, we need to really think about what it means to be bringing up residents who don't know how to manage these types of things. And what are we going to do in the future to ensure that our lack of ability to train our residents doesn't result in our patients dying, quite frankly, because they don't have physicians who can provide them the care that they need.
Yeah. And to that point, I think it is hard for training programs to try to institute these things, especially in states outside of California. I think we are sheltered sometimes in California where we feel like we can do these things. But even within California, like you're saying, some programs are not training as well. I mean, fortunately, there is a residency fair going on in the conference room, maybe you can go over there and talk to some program directors and say, hey, we really need to get this training going. But in light of physicians practicing right now, what are some practical ways that we can do today, or some steps we can take in order to make contraception and abortion care more accessible within our busy primary care settings? Once they do become attendings and they're practicing, what can we do right now?
Well, with contraceptive care, I, would just really like to encourage every family physician out there to offer all of the contraceptive options and figure out the logistics that are needed in your particular facility or health center or clinic to be able to offer things like same-day LARCs. I know that there are oftentimes logistical and administrative barriers, and there's these hurdles that you have to clear, and sometimes it's about your contracting with your health plans, but figure those things out so these types of structural barriers aren't the things that prevent your patients from being able to get the care that they would like. And then for family physicians, I believe that every family physician can provide medication abortion. It's really simple. It's really straightforward. And again, there's often logistical and administrative barriers, but there aren't medical barriers. And so, an interested family physician can go out there and learn how to provide this service. There's just a wealth of resources out there to help family physicians, even family physicians who work in federally qualified health centers, set up medication abortion programs. And so I would just really encourage anyone with even the tiniest inkling to pursue that and provide this type of care, both because it will expand access for our patients, but also because that might be an opportunity to train future family physicians.
Thank you so much for mentioning all of the resources that are available for physicians to access. We will include those resources in our show notes. And Dr. Connolly, you are incredibly involved, obviously, in advocacy at CAFP and AAFP, so our state and national level. And we're really proud that California and CAFP has positioned itself as a leader in protecting reproductive rights. What lessons do you think maybe other organizations or other states can take from our approach? And what challenges do you think might remain?
Well, I think in California, one of the great things that has been done is it was actually passed just a couple of years ago. The right to abortion is enshrined in our California state constitution. And that is a really, really important protection. And there's been a few states who have done this. And so from a legislative advocacy standpoint, I think if you're in a state where abortion, the future of the legality of abortion may be questioned, that is one way to add protection to abortion. And then as far as just advocacy in general goes, I think we all individually can do some advocacy, but we are much stronger in numbers. And this is where we have opportunity to use our professional societies and whatever other, professional organizations you're in, to really use collective voices to be heard. And I'm very, very proud that the CAFP has always been really good at that. The AAFP is also very good at that. And it's just all about, members encouraging their professional organizations to step into this arena, even if it feels a little bit scary, and really use our collective voice to make a difference and make political change.
And speaking on that topic of making political change in health policy, if you had a magic wand that CAFP or AAFP gave you, and you can see one major change in women's health policy or practice in the next 5 years, particularly around reproductive health, what would that be?
I mean, if I had a magic wand and a lot of political control, I think I would go back to the Supreme Court. I would go back to when Roe versus Wade was overturned and make that not happen. But actually, one thing that I have thought a lot about is, how Roe versus Wade got overturned. And the whole sort of point of Roe versus Wade was that abortion was included as a right to privacy, right? That women and other people who get pregnant have a right to privacy, and that's why Roe versus Wade protects abortion. And I wish instead we had said that women and other people who can get pregnant have a right to bodily autonomy, because that's really what we're getting at. And if we could just agree as a country that people have a right to bodily autonomy, I think we would do some great good in this world. And that's true of many, many different aspects of medicine, not just abortion.
I love the way you framed that, the right to bodily autonomy, because I think that is very universally understood and accepted. Thank you so much, Dr. Connolly, today for sharing your experiences, your expertise, and perspectives on women's health and reproductive care. This conversation was so insightful and just so incredibly important. And it was a great reminder of the role family physicians play, not just in the exam rooms, but in protecting access, training the next generation of learners to be physicians, and advocating for that health equity and reproductive justice. And for our listeners, you'll find links in the show notes to CAFP resources on reproductive health, training, and advocacy opportunities. Thank you so much, Dr. Connolly, for being here today and sharing your experiences with us. And thank you, listeners, for tuning in to the Family Docs podcast. We'll see you next time.
Bye.
Don't forget to subscribe, rate, and share the Family Docs podcast. Come back for more discussions on pivotal topics in the medical field. Thank you for tuning in. And until next time, this is your favorite family physician.
And your other favorite family physician,
Dr. Rob Assibey.
And Dr. Cynthia Chen-Joea. This podcast was created, produced, and recorded by the California Academy of Family Physicians. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent or the California Academy of Family Physicians.